Well, welcome back. Did you know June is Men's Health Month? And it's a good time to remind us men that a healthier life is a better life. And that certainly means getting screenings and tests. Joining us this morning is Dr. Daniel Jaffe with Affiliated Urologists. Thank you very much. And I always have to ask this question because what is it about us men that we don't like to go see our doctor?
You know, it's funny. I don't know. I feel it myself, though. I'm probably not, they say physicians are the worst patients, and I'm probably among them. I feel it. I don't like to take medicines myself. And a lot of men have to get dragged in by their wives to see a doctor. But it's very important. And for Men's Health Week, I want to stress the most important thing, which is be healthy, eat right, exercise regularly, but see your doctor once a year and get the regular checkups that you need.
And when we talk about checkups, there are certain benchmarks, certain age limits which indicate we should all be checked.
That's right. So as a urologist, I talk a lot about prostate cancer, so we want to screen for that. And a lot of people say, well, I feel fine. I don't have prostate cancer. Well, prostate cancer is something that is silent until late in the game, and so we want to screen for it, and that's starting at age 40 if you have a family history or if you have certain risk factors, African Americans. Otherwise, age 50, you need both a prostate examination to make sure that there's no lumps or bumps, as well as a blood test called the PSA. And that's very important to catch it at its earliest stage when it's curable. And that's really, the key to screening is catch disease when it's curable.
Yeah, and early detection can really mean a difference, especially if you're diagnosed and you're fighting it.
Absolutely. Colonoscopy is going to pick up another silent disease. You got polyps that can be caught before they turn into cancer. So you're not going to feel anything. You need to have the screening colonoscopy. Traditionally at age 50, now there's even a push to start doing it earlier.
And why is that push? Because that was a recent notification as of last week.
Not being a specialist in that field, I can't get into it in depth, but I do know that the numbers of young detected colon cancer is going up, shockingly.
What are some of the other things we should be on the lookout for?
Well, so you want to do the routine blood screenings, such as, a lipid screen is going to put you in a risk category for are you at risk for a heart attack or for a stroke. Some screening tests are for things that are silent, like I talked about. Sometimes there are symptoms, and people, especially men, are going to sort of push them to the side and say, well, it's just part of aging or whatever, I'll just ignore it. There are even surveys you can take online that you can fill out and see what is your score for for instance, urinary symptoms. And that can indicate the degree to which you've got a very, very common problem called BPH, enlargement of the prostate, which if caught early and reversed with a new treatment, which is actually very, very low risk compared to the others, it can prevent the bladder from becoming unhealthy. Whereas if it's ignored and left alone, the bladder actually becomes worse and becomes a more difficult problem to treat.
All right, good information. And again, not only this month, but we should be practicing all this stuff.
Absolutely.
All the time. Get in, talk to your physician, and make sure that you're healthy, especially during Men's Health Month.